Good afternoon, everybody. Firstly, it's great to see so many of you logging in now to find out more about sort of the pharmacy profession more generally, and also pharmacy at Swansea University. I'd also like to introduce my colleague, Dr. Amira Guirguis, who is the MPharm Program Director at Swansea University. So between us, we've got a sort of a short presentation that we want to go through. I'm going to sort of start off just by, I guess, just setting the scene really about sort of pharmacy at Swansea University. I'll then hand over to Amira, who will sort of focus more on some of the roles which pharmacists can carry out. And then we'll come back to me and I'll talk a bit more about sort of pharmacy, more specifically at Swansea University. So I'm now going to hopefully be able to share my screen with the presentation. And if I click this button here, hopefully, can my colleagues just confirm that you can see my slideshow?
Yeah,
I can see a nod and a thumbs up. So thank you very much. So I'll kick things off. And the reason sort of we're here, so we're starting pharmacy at Swansea University. It'll be the first new pharmacy course in Wales for over 100 years. So it's something we're all hugely excited about. And pharmacy is changing massively at the moment. There are new roles, new career options. So it really is the right time for you to be considering, I think, pharmacy as a possible profession. So pharmacy at Swansea University is based within the medical school, and we're a very highly ranked medical school. So only 2 weeks ago, the Times and Sunday Times published their medical school rankings, but we were thrilled to see Swansea as top 3 once again. We're also top in Wales and 7th in the UK for medicine in the Guardian University Guide, and similarly ranking very highly for research environment, and also the university as a whole. We come in the top quartile of the top 25 universities in the Guardian ranking. As a university, we're also TEF Gold ranked as well. That's really important because when you go to university, I guess the teaching that you receive is really going to shape your degree and your future career. So the fact that Swans is TEF Gold, I think, is particularly important. Okay, so I appreciate that because we're doing this remotely, you haven't had the opportunity perhaps to visit Swansea University. So really, this is for those of you who are joining us perhaps from outside of Wales or even outside of the UK in particular, just to highlight. So we're a city based in southwest Wales, the second largest city in Wales, with a population of over 250,000. And what we're particularly proud of, I think, is the fact we have 2 seafront campuses, one of the only universities in the world that can actually boast that. So not only are you getting an excellent education, you're also getting a fantastic student experience, and very easy to get to us from the various public transport hubs within the UK. So yeah, at this point, I'm going to hand over to my colleague, Amira, who's going to sort of focus very much on sort of pharmacy as a profession. And then she's going to look into some of the sort of specific roles which pharmacists can conduct. And then I'm going to come back to you in 10 minutes or so and talk to you more about sort of how you actually then sort of study pharmacy at Swansea and ultimately then register as a pharmacist in the UK. So I'll hand over to Amira now.
Thank you, Professor Morris. So what is pharmacy? Pharmacy is a profession that produces pharmacists. And what pharmacists do, they are the experts in medicines. So as a pharmacist, I am a scientist as well as a clinician. So basically, pharmacists, they have the science that underpins the design and development of medicines, but also they are clinicians, so they are able to understand how to carry out a patient-centered care, ensuring that patients effectively use their medicines, but also they are able to monitor them, ensuring that patients are not going to suffer any harms from their medicines as well. Pharmacy is a profession that provides you with the analytical mind and a patient-centered approach. And this means that you think about the treatment of your patient. And in fact, pharmacy in the UK has changed dramatically over the last decade or so in the UK. So the pharmacist role has shifted from the supply of medicines to the management of medicines of very complex patients. Pharmacy is the third largest registered healthcare profession in the UK after dentists and doctors. So basically, as a pharmacist, for example, I am registered with the regulatory body, which is the General Pharmaceutical Council. As Professor Morris mentioned, the pharmacist role has changed dramatically over the last few years. And because the NHS and the private sectors needed more and more pharmacists, so there were more new roles that were created. So what do they actually do? And if you complete a degree in as a pharmacist, basically this is as if you have a global passport degree, because you can work in so many sectors. So you can work in community pharmacy, and this is like, for example, the shop on the high street, like Boots, like Lloyd's, like other independent pharmacies, for example. You can also work in hospital. You can work alongside nurses and doctors and other healthcare professionals looking after patients who were admitted to hospital for medical or surgical reasons. You can also work in industry, and in industry, you can work in the development of new drugs, for example, in developing new vaccines for COVID-19, for example. You can also work as a digital pharmacist. And we are very fortunate at Swansea University because we have the Sales Data Bank, which is one of the largest healthcare data banks in the UK. And a digital pharmacist, for example, when you call 111, you may actually get a response from a pharmacist who is able to answer your query. So that's one example. You can also work as a GP pharmacist. And if you work as a GP pharmacist, you may become a prescriber and you may run your own clinic and you may specialize in a certain therapeutic area. So, for example, you may become a respiratory pharmacist or a cardiology pharmacist. You can also work in prison pharmacy, where you are the pharmacist looking after the health of prisoners. You can also work in veterinary pharmacy, military pharmacy, care home pharmacy, regulatory affairs. And in regulatory affairs, you basically look at the portfolio presented by different companies who produced a certain medicine, for example, and you are kind of responsible to ensure that all the different tests have been done appropriately and the medicine can be granted a license to be marketed on the market. You can also work in academia like myself, for example, and Professor Morris. You can teach at university and you can carry out your research. And there are so many more opportunities that pharmacists can do. So if you join the pharmacy degree, we give you opportunities of experiential learning, and these opportunities will help you to become a pharmacist. So this means you will get different opportunities and placements in different sectors of pharmacy, and you can have opportunities in hospital pharmacy, in community pharmacy, in GP practice, but also in academia, where you can carry out research projects. And this is an example of pharmacy research. And this is myself, and this is my research focusing on drugs of abuse and drug detection. And this can show you that you can carry out research up to a high level where the novelty in this research can be recognized nationally and internationally as well. So I will hand over to Professor Morris now.
Great. Thanks very much for that, Amira. And so, as Amira sort of highlighted, so both myself and her are registered pharmacists working in academia in the UK. And just on a sort of a personal note, when I think back to, I guess, when I was sort of at sort of the start of my sort of pharmacy career when I was completing my A-levels and applying to pharmacy schools. I don't think I could have thought, I guess, of the opportunities which sort of pharmacy would have presented to me. So that's included sort of working in clinics and community pharmacies, also in sort of primary care NHS settings, but it also gave me the opportunity to travel as well, and I was able to work as an academic pharmacist overseas in Southeast Asia as well. So I guess pharmacy as a career, just to highlight, has opened a huge amount of doors, I think, for me personally. So once you have a pharmacy degree, and I'll talk to you a bit more about the Swansea programme in a moment, but of course that there are pharmacy degrees at other universities as well. You need a pharmacy degree, you need to graduate with that. They're typically 4-year courses. And once you've then completed that degree, you would then apply to do what's currently called your pre-registration training. So that's a period of about 12 months that you spend training under an experienced registered pharmacist. That might be in a community setting or a hospital setting or in primary care. And then at the end of that pre-registration training, you then sit a registration exam. So that's an exam set by the General Pharmaceutical Council, or the GPHC. So then as long as you pass that exam and then meet 1 or 2 other GPHC requirements related to health and good conduct, you're then able to register as a pharmacist in the UK. Just, I guess, a couple of things worth me perhaps highlighting about sort of the pre-registration training. So firstly, that is a salaried period of training. So you pay your 4 years of fee for the 4-year MPharm degree. But then after that, when you move into pre-reg training, you then start, essentially it's your first job. And I've got some information on salaries in a moment. It's also worth noting that Wales is quite unique because it has a national multi-sectoral pre-registration scheme. So that means that if you opt to sort of study and then train within Wales, then you actually have the opportunity to apply for multi-sectoral training, where you spend a period in community pharmacy, a period in sort of the secondary care setting, it's in a hospital, and then a period in GP practice as well. So particularly exciting. And also, I think it's very much worth noting that by the time you get to the point of starting your pre-registration training, that year will have changed somewhat. We expect the name of it to have changed. And also, we're expecting that you'll actually sort of see that pre-registration period becoming an independent prescribing training period as well. That's at least what's been talked about in the profession. So I think it's particularly exciting that ultimately after that 5-year period, you could then have the same types of prescribing rights and responsibilities as a GP or a dentist. Okay. So just sort of focusing in on that in a little bit more detail. So particularly it's the Welsh scheme, which is particularly exciting, which has these sort of 3 different areas. And that's because the Welsh government have put in a huge amount of funding also to increase the number of training places in Wales. So when you start your pre-registration year, you would go on to an NHS Band 5 salary. So that's almost £25,000 currently at the 2020 level. So that's if you were to stay and do your pre-registration training within Wales. In England, the salary can vary somewhat, but in Wales, all of the pre-registration pharmacists are guaranteed that Band 5 salary. And once you've finished that pre-registration training and you've then registered, that then opens up the possibility for you to move into whichever sector you want, really. So these are just some examples of pharmacy adverts that I took from the Pharmaceutical Journal. And so both of these are sort of aimed potentially at newly qualified pharmacists. So the top one of these is for community pharmacy. So this is, as you can see in the job advert, it says sort of opportunities there for newly qualified. So you can be looking potentially at positions like this in just 5 years after you start your pharmacy degree. So some very strong salaries in the community pharmacy setting. The second job advert I've got is a hospital pharmacist post. So you might recall I said the pre-registration training period for 1 year is a band 5. As a pharmacist, you then move on to band 6 within the NHS. And that sort of the NHS band 6 salary starts at over 30,000 and goes upwards to about £37,000. So again, that's what you're earning just 5 years after you start your pharmacy degree. It's also worth sort of noting that what many pharmacists choose to do is work as what's called locum. So that's where you are essentially a self-employed businessman or woman, and that really sort of gives you the opportunity to very much sort of choose which sort of sector you want to work in, which company you want to work in. And certainly in community pharmacy in South Wales, the locum rates are typically around about £21 per hour, but they can vary quite dramatically. I know during the Rugby World Cup final, that went up to about £45 an hour on Saturdays. So it's very much a supply and demand situation for locum pharmacists. Okay, so I guess what I'd like to do now is to sort of just talk to you a little bit more about the MPharm course at pharmacy. Sorry, at Swansea University. And what I should say as well, as my colleague Emma said at the start, we've got the Q&A function open. So if you do have any questions that you want to ask as I'm talking through, feel free to type them in. We'll either take those questions at the end, or if there are any particularly pertinent questions, then one of my colleagues might sort of jump in as well. But we'll probably aim to answer many of them at the end. But please feel free to ask them. But do bear in mind, so today we are recording this presentation, so keep your questions of a sort of a generic, non-personal nature. If you do have any specific questions, then we can always get back to you separately regarding those. So in terms of so the MPharm course at Swansea University. So we teach sort of largely integrated modules. So when we talk about integrated teaching in pharmacy, that means that we're bringing the science and the pharmacy practice together. So the aim of that is to demonstrate to you why a particular topic in chemistry is relevant to your practice as a future pharmacist and how it impacts upon patients. So our integrated modules are taught around these sort of 7 subject themes. You'll recognize some of these, no doubt, but others there might seem a little bit sort of alien to you. So the first one of these is pharmaceutics. So pharmaceutics is really the science of turning a drug, that might be a pure white crystalline substance, how we turn that drug into a medicine which a patient can then take. So the medicine could be a tablet, or it could be a liquid, or something like an inhaler even. So that's what we mean by pharmaceutics. Pharmaceutical chemistry, that's very much building upon A-level chemistry that you may have done, or chemistry in other pre-university qualifications. So largely the focus is on organic chemistry and synthesizing drug molecules, but there's also elements of sort of physical chemistry as well, particularly around the analysis of drugs in samples. And then we have pharmacology. So that's very much about the action of the drug on the body, so how a drug exerts an effect. Then we have biology and biochemistry. So we're starting to very much sort of think about body systems. And that sort of very much goes into the anatomy subject area as well, and the physiology. So we're starting to think about, say your cardiac system. How does that operate when you're healthy? And then what happens when something goes wrong? Clinical pharmacy is very much where we are thinking about the essentially the sort of doses of drugs, which drugs we should use for which conditions. We think about drug interactions and sort of more complex cases of polypharmacy where patients are taking lots of different medicines. And also sort of pharmacy practice is very much sort of focusing on other elements of what pharmacists do on a day-to-day basis. that might involve ethics. It might involve pharmacy law. And you may not realize that most or many high street community pharmacies will have heroin stored in their controlled drugs cabinets in the form of diamorphine. So clearly the legal requirements of storage and supply and receiving potentially lethal drugs such as the strong opiates, it's important that pharmacists understand that. And sort of on top of these 7 subject themes that we have, we also have what we call a digital thread, which is running through our pharmacy degree. And that's really bringing together sort of some of the future elements of healthcare, thinking about perhaps personalized medicine, areas such as computational chemistry to develop new drugs, and looking at the big data and AI. And my colleague Amira mentioned the SAIL data bank, which Swansea University is renowned for, and they're doing a lot of excellent work in sort of tracking COVID. And as we've seen more and more over the last 6 months, the use of remote consultations in healthcare. And there are, of course, advantages to that. It means that I'm now sat here in front of my computer and I'm able to talk to people, of course, from all over the UK or even wider across the world. Okay, so one of the questions we often get asked with regards to sort of studying generally at Swansea, but also related to pharmacy, is what are the options of studying abroad as part of our studies? And personally, I think that's something which, if you have the opportunity, you should try and seize that very much. So as I said, I spent a lengthy period of time overseas at the University of Nottingham's Malaysia campus, where I was sort of teaching pharmacy over there. So I can sort of see, I think, firsthand the importance of having an international experience in your education. And at Swansea University, we have a number of summer vacation programs which you can all apply to do, and giving you opportunities within that vacation across different parts of the world. Now, we hope very much that when you start your pharmacy degree in September 2021, we will have seen the back of the COVID crisis. And certainly I would expect that during the 4-year of your MPharm program, there will once again be opportunities to study overseas. But I should say as well, I think internationalization isn't just going abroad, it's also studying alongside students from other countries. It's learning from your academic lecturers who might be from overseas as well. And we also incorporate international elements into our pharmacy curriculum as well, such as the sustainable development goals. So internationalization, I think, is a particularly important element of the pharmacy program. So if you were to come to study pharmacy at Swansea University, who would you see? So at the moment, this is the pharmacy team. We've recently appointed 2 other academic staff as well who'll be joining us. And this is a team which is growing further as the course expands. And there will be many more added to this pharmacy team as well before the start of the term in September 2021. So my colleagues that I've listed here are bringing sort of expertise in the areas of pharmaceutical chemistry, analytical chemistry, pharmacy practice, business and entrepreneurship. Through Maya Davis, we have the previous director for Wales from the Royal Pharmaceutical Society as an honorary professor, and also Dr. Neil Hartman, who is head of nuclear medicine and also originally a pharmacist at Singleton Hospital in Swansea as well. So we're bringing together, I guess, a group of experts with sort of specializations in many different exciting areas. But of course, one of the benefits of pharmacy being based within a medical school is the fact that you will also have the opportunity to come face to face with many of our other medical school staff. So where we'll bring in lecturers from our medical program who have expertise in specific areas to also teach on the pharmacy program as well. There will also be researchers you'll meet. We'll be bringing in industry experts. And we've also recently appointed our first teacher practitioner with Swansea Bay University Health Board. And teacher practitioner posts, I think those are particularly important for you as you're starting to find out more about the pharmacy profession. So a teacher practitioner is somebody who spends roughly 50% of their time working usually within the NHS. And so their day-to-day practice is sort of perhaps working with a particular specialism, working with patients. But then the other 50% of their time, they spend at the university teaching you, delivering workshops and delivering lectures as well. And there will be more of these teacher practitioners as the new course rolls out. Excuse me. So what is our typical offer for pharmacy? So if you're studying A-levels, that would typically be in the range of ABB to BBB at A-level. The one A-level that we do expect you to have is chemistry, and that needs to be with one other STEM subject. So that could be biology, maths, or psychology. And your third A-level, that can be something non-STEM related. And if you're joining this webinar from Wales, you might be familiar with the Welsh back. We also count the Welsh back as a third A-level as well. So particularly important that you do well in that particular subject. Also, if you're doing international baccalaureate, we'd be looking at sort of 32 to 34 with level 6 in chemistry plus one other STEM. And we also expect you to have GCSE mathematics grade C and also grade C at English as well. So if you apply to us, you meet our entrance requirements, we will go through your UCAS statement, and then if we're content that you meet our minimum entry requirements, we would invite you for interview. So we have what we call multi-mini interviews, or MMIs, at Swansea University. So an MMI is where you spend a short period of time at a particular station, and then you move to another station, and you do 4 or 5 in rapid succession. And very soon we're going to be publishing guidance to MMIs on our Swansea website, really to sort of help you prepare for the MMIs at Swansea. So unfortunately, it seems it's not going to be possible for you to actually visit the campus for our interview day this year. So what we will be doing is holding our MMIs using the Zoom platform. That's something that we've done before. We've held remote interviews for international students as well last year on our medical program. So it's certainly nothing to worry about. And I think in some respects, I think you've probably all been using Zoom and Teams over the last few months. So it's something I'm sure you're all becoming very comfortable with using. Also, because as a pharmacy student, you'll be coming into contact with patients as part of our experiential learning. So if you're offered a place to study, you'll also need what we call a disclosure and barring service check, or a DBS check. Okay, so that's essentially sort of checking for any issues with criminal convictions, etc. And also an occupational health check, which may include checks for immunity and vaccinations, etc. If you're looking at either of those 2 bullet points and you're getting a little bit worried, and you think that maybe for one of those reasons there might be something that you're worried may stop you studying pharmacy, well, firstly, please don't worry. I would ask you to get in touch with us, and then we can find out more about what your concern is, and we can sort of counsel you as to whether that is likely to cause a problem. But please don't write anything like that in the chat function at the moment. We'll do that offline if you wanted to. Okay, and also this is just I guess a bit of text which I would have to put up as well. So the General Pharmaceutical Council also carry out its own health and good character identity checks, etc. So this is something that the UK regulator just expects all pharmacy schools to inform their students on application. Okay, so where will you live? So we have sort of two main campuses at Swansea University. So pharmacy is largely based at the Singleton campus, but we also have a brand new Bay campus as well. So we have accommodation at both of those main campuses and also at other sites around the city as well. It's also worth noting that Swansea came third in the most affordable cities to live in as a student in the United Kingdom. So I guess that should also tell you that there's an awful lot of affordable accommodation outside of the main university accommodation as well. And so as part of our various open days that we have, and do sort of check our website for any other open days that we have, there will be virtual tours of accommodation that we will be able to arrange for you as well. So I guess what I'd also like to say, although I was talking about the fact that pharmacists can earn a very good salary very soon after qualification, I do fully understand that going to university is, I guess it's an expensive decision to take. And of course, pharmacy is a 4-year course as well. So it's worth noting that Swansea University have a number of scholarships and bursaries as well. So we have our excellence scholarships. So those are for students who get 3 A's at A level or equivalent. So that's over the course of the degree, that would be £3,000 in total. So that would be paid sort of £1,000 in each of the 3 years of the course, I believe. And then also our merit scholarships for students who get AAB at A level or equivalent. So that's a total of £2,000 as well. There are also other scholarships, and you'll find more details of those on the university website. And we're also looking at Welsh medium provision scholarships as well. And it's also worth noting that there are the fee structure and scholarships are different for international students as well. So if you're an international student, please do check our website or contact us if you have any questions about the international fees and the different scholarships for international students. Okay, so I appreciate that there's only so much that I can talk about and you can take in a sort of a short webinar. Hopefully that there are things which you will have learned in this webinar, and it's sort of very much sort of sparking your interest within the pharmacy profession. We've got other information on our website, but I just wanted to highlight 3 quite useful resources for other further information as well. So the General Pharmaceutical Council, that's the regulatory body for pharmacy in the United Kingdom. So it's the GPHC which sort of look at education and training, and they essentially have the remit for the pre-registration training year, which I mentioned. So they have information on their website. Also, the Royal Pharmaceutical Society, so that's the professional body which pharmacists can be members of. So both myself and Amira are members of the Royal Pharmaceutical Society. So they've got a lot of information about pharmacy careers on their website. So I'd encourage you to look at that, and also their publication, the Pharmaceutical Journal, is useful as well. It's worth noting as well that if you were to become a pharmacy student, you can join the Royal Pharmaceutical Society free of charge for the duration that you are a pharmacy student. And that gives you access to quite a lot of sort of free resources, the Pharmaceutical Journal and various other texts as well. And also there is a UK-wide student group called the British Pharmaceutical Students Association. And yet I'd encourage you all to join that if you become a pharmacy student. So they hold a variety of sort of learning, social and sports events around the United Kingdom. Sort of culminates in a week-long conference during the Easter holidays as part of so the Easter break of your degree. So that's something which I would all encourage you, say, to join and then make use of some of the functions which they will be running.